Joining us now is Dr. Ashish Jha. He's the Dean of the Brown University School of Public Health. Dr. Jha, good morning. Good to see you.
Good morning. Thanks for having me on.
So we just heard from Keir that we're seeing lockdowns across the pond. There's some in London. They're talking about France and Germany. And Europe's always sort of been a precursor to what's going to happen here. What happens there, and then 4 weeks later, something happens here. Are we expected to see lockdowns coming up anytime soon?
Yeah, so their latest outbreak really did get going about 4 weeks before ours did. And for the first couple of months, they largely ignored it. And so if we continue to ignore ours, that may be where we're heading. I, of course, think that would be not where we want to be. And so there's still a lot we can do to avoid it. But it just depends on what we do now. We can't wait much longer.
I guess the question is, since we're not in lockdown, what should we do now? Do you think we should go back to the way it was in the springtime when people weren't going to the grocery store for just one item, weren't traveling as much, mainly stuck close to home?
Yeah, so we've learned a lot since the spring. So I think we know a lot of things are safe. Certainly anything outdoors is reasonably safe, especially if you're wearing a mask. I think if we get everybody to start wearing a mask, I think if we, limit the amount of interactions we have, keep our social gatherings to a small number, those are things we can do right now. And I do think there are places where bars and indoor dining is open. If we can peel back those, we can avoid the lockdown that none of us really want.
We have a big day tomorrow. There are going to be 40 to 50 million people going to the polls to vote. We're going to do a story coming up on ways to do it safely. But do you think voting is safe?
I do. I think in-person voting is very safe, especially if people follow some basic precautions. You can probably predict what I'm going to say. You should wear a mask. You should do a certain amount of distancing as you're standing in line. Might be cold, so wear some warm clothes. And then one of the things I've been recommending to people is look at the ballot beforehand and know what you're going to vote for. Go in, don't spend too much time indoors, vote and leave, and use a little hand sanitizer. If people do that, it can be as safe as going to the grocery store or even safer.
So, Dr. Jha, when you're chatting with your colleagues about what you think is ahead, how do you see it? How do you see things around Thanksgiving and Christmas time?
If we leave things on the current trajectory, then we are going to be in a lot of trouble. And I think those are the words Dr. Fauci used. And I think all of us agree with that. If we see governors and mayors take action at this point, we're not expecting a lot of action from the federal government. But if we see action from governors and mayors, we can turn it around and have a bit more of a reasonable holiday season. But it will depend on if we act relatively soon. We can't wait until the season is upon us.
Yeah. All right. Well, Dr. Jha, we appreciate your time this morning. Thank you.